Hi there, I'm Dr. Candice Bovell, a registered clinical psychologist. If you are an adult living in Ontario and experiencing anxiety, stress, or depression, I'm here to help.
What are phobias? A phobia is an overpowering and illogical fear of something or some situation that poses little real threat but provokes anxiety and avoidance. If you have a phobia, you may experience a deep sense of distress or panic when you encounter the source of your fear. Fear can be of a certain place, situation, or object. Unlike generalized anxiety disorder, a phobia is usually connected to something specific. For example, glossophobia. This is performance anxiety, or the fear of speaking in front of an audience. People with this phobia have severe physical symptoms when they even think about being in front of a group of people. Acrophobia is the fear of heights. People with this phobia will avoid mountains, bridges, or the higher floors of buildings. Symptoms include vertigo, dizziness, sweating, and feeling as if you'll pass out or lose consciousness. Claustrophobia is the fear of enclosed or tight spaces. Severe claustrophobia can be especially disabling if it prevents you from riding in cars or elevators. Aviatophobia is the fear of flying, which can interfere with your ability to travel when needed. Dentophobia is the fear of the dentist or dental procedures. This phobia generally develops after an unpleasant experience at a dentist's office. It can be harmful if it prevents you from obtaining needed dental care. Hemophobia is the fear of blood or injury. A person with hemophobia may faint when they come in contact with their own or another person's blood. Nyctophobia is the fear of the nighttime or darkness. This phobia almost always begins as a typical childhood fear. When it progresses past adolescence, it's considered a phobia. Arachnophobia is the fear of spiders. Cynophobia is the fear of dogs. Ophidiophobia is the fear of snakes. Phobias can interfere with your work, school, activities, and personal relationships. The good news is, clinically supported treatments for phobias are available at WellnessView Psychological Services Ontario. The treatments include cognitive behavior therapy, or CBT, that teaches you how to challenge and change problematic thought patterns and unhelpful behaviors that contribute to symptoms, and exposure therapy that involves gradually exposing you to what you fear and not avoiding the phobia object or situation. Also, relaxation training and behavioral activation, which involve regularly practicing breathing exercises, relaxation exercises, and engaging in activities that are relaxing, enjoyable, or useful. A minimum of 4 to 8 therapy sessions is recommended.
If you would like to book an appointment, please visit www.wellnessview.ca and complete the confidential screener.
Thanks for watching. Please like and subscribe.